Hi, today I'm going to present on what is a licensed professional clinical counselor and how does it compare to other mental health licenses here in California. But first, my name is Corinne Eisenhardt. I'm a licensed professional clinical counselor in California and a licensed professional counselor in Michigan and Colorado. I also hold a National Certified Counselor certification from the National Board of Certified Counselors, or MBCC. If you want to learn more about myself, you can find it on my website, therapywithcorinne.com. Now, I'm presenting on behalf of CALPIC, the California Association for Licensed Professional Clinical Counselors, and I have been involved with CALPIC for a while now. I started out as a member, then I was a board member for 3 years, and currently I serve as a co-chair in the Los Angeles region.
Now, reasons why I thought it was important to create this presentation is twofold. One, in moving to California from Michigan, I found that the counseling license was much lesser known in this state than in Michigan. And I found that there's a lot of misinformation about the license, including hearing misinformation from other LPCCs or professional counselors, which is both harmful for the profession and affects the professional counselor's ability to get hired in this state. So I wanted to create this presentation to help educate and correct misinformation about the license. Secondly, I wanted to create this resource for others to be able to use to educate and advocate for the profession. This PowerPoint will be available for you to download on the CalPIC website, along with some other resources. So go check them out after you're done viewing this video. This video can also be shared with anyone you feel that needs to know more about the LPCC license. So today I'm going to cover why the LPCCs are lesser known in California, what the education and training is, the scope of practice, where LPCCs can work, the approach, and other important information, including new developments. But first, I have a quick disclaimer before I get started. I will be comparing licenses in this presentation, but I want to note that I believe that there are no license better than the other. They are different, but each have their place in the field. And right now, with the known shortage of mental health professionals, there is more need than supply. So we need to support each other to be able to support more clients and consumers seeking out mental health services. Now, there are three main master's level licenses in California and in the United States: the marriage and family therapist license, the professional counselor license, and the clinical social worker license. Now, in this presentation, I will do a lot of comparisons with the marriage and family therapist license to the professional counselor license, because the LMFT license is more well known in the state. And like the LPCCs, it is a fully clinical degree. And the LCSWs, the social workers, can often work as other roles in the community, including case management and other advocacy roles. I also wanted to point out on this slide that the names of the marriage and family therapists and the clinical social worker are consistent across states. However, if you look at the professional counseling license, the names of the counseling license varies from state to state. This is because each state has the authority to name its own license, and they just chose to name it differently. I wanted to cover this because I've heard counseling professionals from other states say that their license is different than mine because they have a different license name. This is a misconception. The different names of the professional counseling license can be confusing and in some ways make us less united as a profession. But we are all professional counselors with the same general education and license requirements. And our education teaches us the same approach to mental health counseling and psychotherapy, which I will be discussing more later. So why are the LPCs lesser known in California? First, I'm going to start with some numbers. Now in this graph, you'll see the numbers of mental health professionals from each master's level license. In yellow, it shows United States stats, and in blue, you'll see the numbers in California. Let's start by looking at the number of counselors nationwide. You'll see that the counselors have more than double the amount of MFTs. It's actually 2.34. But when you look at the numbers in California, MFTs have more than 14 times the amount of LPCCs. Now, looking at the number of social workers nationwide compared to the LMFTs, social workers have more than triple the amount of MFTs. It's actually 3.48. But in California, the marriage and family therapists have significantly more than the amount of social workers, about 1.43. You can see on this graph that California is very dominated by MFTs and even make up 65% of the marriage and family therapists in the nation. So lastly, the counselors really dominate in the United States, but have limited numbers here in California. Now, this is a document I downloaded from the American Counseling Association website and is where I got my stats for the national numbers in the graph in the last slide. I wanted to include this document because I do find it fascinating, and I thought others would also. It breaks down the number of licensed professionals in each state. So if you're interested in looking at this document, I will include the link to the document below. So why are there fewer licensed counselors in California? Now I'm going to talk about a timeline. I have included the social work license, the marriage and family therapist license, and the LPCC license, the counseling license. The yellow dots on the timeline indicate the year that the first state adopted the license, and the blue dot indicates the year that all 50 states adopt the license, and the state who was last for each license. Now, starting with the yellow dots, something to point out is that both the social work license and the marriage and family therapist license started here in California. So California was where they originated. And you'll see all the way on the right that California was the last state to adopt the professional counseling license. This was 46 years after the marriage and family therapist license, which means they had a lot of time to establish themselves in the state before we were even established. Another interesting point to note on this timeline is that the marriage and family therapist and the professional counseling license were both adopted in all 50 states at the same time in 2009. California was the last state to adopt the LPCC license, and Montana was the last state to adopt the LMFT license. Now, a misconception that I often hear is that the LPC license is a new license. And in reality, it is a newer license to California, but is not a new license. Professional counselors just first got their license in Virginia all the way across the country at generally the same time as the LMFTs. And all three licenses really got the last state to adopt at the same time in the early 2000s. Now, I also want to point out that we have had the license since the 70s, which is over 45 years, but the counseling profession can be traced back to the late 1800s, starting with Frank Parsons' work related to vocational guidance, career counseling, and school counseling, and with Clifford Beard's effort in clinical mental health advocacy. Then, in the mid-1900s, the profession gained more autonomy and visibility with Carl Rogers and his client-centered approach. So again, the counseling profession is not a new profession or a new license. Now, another reason I suspect that there are fewer counselors in the state is that there was a lot of compromise when winning the license here in California. So to get the license, the state required us to have additional supervision hours and classes to be able to provide services for couples and families. And there were additional supervision hours required in hospitals or community mental health settings to be able to get the full license. These requirements were not necessary in any other state, but they were established in California as a compromise to win the license. And this was done in response to the advocacy efforts of the other mental health professionals who were already well established in the state. Now, as of January 1st, 2022, the additional requirements were eliminated with the passing of Law AB 462. So there are no longer additional requirements to see couples and families, and no additional hours required to get the license. But I can imagine that these additional requirements in the past have made the counseling career track a little less desirable for students when they're trying to choose a master's level clinical program in California, knowing that they would have to complete a lot of extra steps to get the license. Now, we're very pleased that the additional requirements for LPCCs in California have been eliminated, and it brings us closer to license parity with other master level licenses here in California. And this is thanks to the advocacy efforts of CalPEC. CalPEC worked tirelessly to win the LPC license in California, and they have continued to advocate for the profession ever since. Now, in the past year, we've seen significant growth in numbers of counselors in California. As you see in this graph, there are now more associate professional clinical counselors or counselors in training than there are licensed professional clinical counselors in the state. This is a clear indication that the counseling profession is growing rapidly in California. I believe that this growth will continue in the future due to a number of factors, including others gaining more information about the license and the popularity and efficiency of the new counseling compact, which is a new agreement between states that will allow licensed counselors to practice across state lines. And I'll talk more about this later in the presentation. So what is an LPCC? And let's talk about the education and training requirements first. Now, comparing the LPCC with the LMFT degree, they are both fully clinical degrees, preparing individuals for clinical practice, and both require 60 hours of education. Now, I included the required classes for the counseling degree in the blue box. You'll see that the 13 core content areas give the counselor a full clinical foundation, plus advanced studies in counseling and psychotherapy techniques. Then the degree requires 15 semester units of advanced coursework, helping counselors to develop knowledge of specific treatment issues or specific populations. Then the degree requires 6 semester units of supervised practicum in a clinical setting, which includes 280 hours of face-to-face supervised clinical experience. This is different from other clinical programs because we only count hours that are specifically for clinical practice. This means that paperwork, notes, research, and case consulting does not count towards those required hours. Then, to obtain the full license, both the MFT and the professional counselor requires 3,000 supervised hours. Now, what differs is that the LMFT can count up to 1,300 hours gained prior to their degree, while the professional counselor needs to obtain all the hours post-degree. Now, I know this is something I've heard other counselors wanting to change, but I don't think that this requirement should change for the LPCC in California, and here's why. It is a standard requirement in most states, and one of the great things about the counseling license is that it's very portable throughout the United States. The portability of the professional license is made possible by the fact that the requirements are standard across states. Therefore, it is important to keep this requirement in order to maintain the portability of the LPCC license. For example, I was able to get my Colorado license in just 2.5 weeks because the licensing requirements were the same as California. If the hour requirements had been different, it would have taken me much longer to get my license in Colorado. Now, what is the scope of practice for the LPCC? I created this Venn diagram to easily visualize the similarities and differences between the scope of practice of the MFT and the LPCC in California. As you can see, they have completely overlapped. This is because we all generally have the same scope of practice and can provide the same services in the state. I have heard a lot of misinformation about the scope of practice of LPCs in California. For example, I have even had someone who is licensed as an LPCC tell me that being a therapist was not in my scope of practice. This is simply not true. LPCCs are fully qualified to provide services to individuals, adults, teens, and children, provide services for couples, families, and groups. They can provide assessments, diagnosis, evaluation, and prognosis. They can give treatment plans and treatment evaluations. They can do psychotherapy, psychoeducation, clinical case management, and career counseling. And they can supervise APCCs, AMFTs, and ASWs. The only current limitation that LPCCs have in California is that we cannot provide assessments that involve neuropsychological, personality, cognitive impairments, and IQ. This is something that is in scope of practice of other master level licenses in California. So it is needed for us to continue advocating for our license to gain full license parity with other master's level licenses here in California. And reasons why I think this should be within our scope of practice is because it does differ from other similarly educated and trained master's level licenses in California. The counseling education does include assessments and diagnosis in its core curriculum. And historically, the counselors have always been experts in testing. The counseling profession began in the late 1890s in the settings of school counseling and vocational guidance counseling, who specialized in administration and interpretation of various tests, including intelligence and aptitude tests. And lastly, it goes against the recommendations of the American Counseling Association. So what jobs can an LPCC have? I listed a bunch of jobs on the slide, but if you think back to the scope of practice and the Venn diagram showing that the LPCCs have the same scope of practice of the LMFT, you can imagine that we can do any of the jobs that the MFT can. However, I do want to point out that not all jobs will list LPCCs in the requirements that also list LMFTs. This is because, again, we are not as well known as the other mental health professionals in the state. And there are still a lot of misconceptions about what our scope of practice is in California. Now, CalPEC has been working hard to advocate for the LPC license. They have not only lobbied on the legislative level, but they've also been working with counties and organizations to have them also hire LPCCs along with LMFTs. We still have a long ways to go, but I'm hoping that we will eventually achieve full license parity with our mental health professionals and will be just as well known as the LMFT license. Now, what approach does the LPCC take? Now, each profession has a different focus in their education and how they approach clinical practice. This slide shows what the general counseling approach is. Counseling education and training help LPCCs to become generalists in the field. Then, after their degree, they can obtain advanced training to specialize in different techniques, theories, and specific client issues. Counselors are trained to treat the client following a holistic approach, with a focus on developmental, prevention, and a wellness orientation. Counselors are trained in many theories, but a large focus is still on Carl Rogers' client-centered and humanistic approach that, again, gained the profession more visibility in the mid-1900s. And then counselors still have career counseling as part of the core class curriculum, which differs from other licenses. Other important things to note about the LPCC license. LPCCs are reimbursable by most managed care organizations and health plans, so they can bill most insurance plans. And as February 1st, 2023, the VA launched a unique occupational series for licensed professional mental health counselors, which is important because it allows counselors to be hired at VAs and by the federal government. And then starting in 2024, counselors will be able to be Medicare providers along with MFTs. So I'm excited about this slide. As I mentioned throughout the presentation, that the professional counseling license is very portable through the United States. Now the portability will only drastically improve with the Counseling Compact. Now, if you've not heard about the Counseling Compact, I will give you a little explanation. It is an interstate compact allowing professional counselors to practice in other compact member states. It is very new and all the compact logistics are still being figured out, but they have published that it will work as a national database that you will submit the general requirements of getting licensed, including education, training, fingerprinting, and more. And then once approved, you'll be able to request privilege to practice, not get a license, but request privilege to practice in another compact state. And it's stated on the Counseling Compact website that privileges to practice could potentially be gained in a matter of minutes. Now, again, this is still being figured out, but they are hoping that the compact privileges will open sometime in the end of 2023 or beginning of 2024. Now, this is moving very fast. When I put this slide together on March 30th, 2023, the map included 20 states that had passed the legislation. Now, as of today, June 16th, when I updated this slide to record this video, the map showed 28 compact states. So that's 8 new states in less than 3 months. A lot of the advocacy efforts started in 2020, and with how long things take legislatively, it's been only taking effect the end of last year and this year, but it's been quite a waterfall effect. To get the most updated map and information, check out the website counselingcompact.org. Now, if you live in California, you probably are wondering about the Counseling Compact in this state. Right now, I can tell you that as far as I know, California has not started the process of getting involved in the Counseling Compact, but look for any updates from CalPIC if you are a member. Now, if you compare this to other licenses, the social work profession has also started creating a compact. They're behind where the counselors are, but they are moving forward to make this happen. And the marriage and family therapists have not started this process as of this year, 2023. And the Marriage and Family Therapists National Organization has ultimately determined that our interstate compact for MFTs wasn't the right fit for the MFT professional goals at this time. So that ends the information about the LPC license, but I would like to make a plug for CalPIC. As you can see in the presentation, there are a lot of changes and updates happening, and it's important to stay plugged in so that you don't miss anything important, especially when it comes to professional practice. CalPIC will keep you informed so that you can avoid costly mistakes and ensure that you provide the best possible care for your clients. Plus, there are a lot of other reasons to join CalPIC, including access to professional development resources like workshops, panels, training, conferences, and more. There's also a lot of ability to network and build community within the LPCCs to help support your growth in the field, help with advice, collaborate with others, and also have help with finding referrals for your practice. Another thing that CalPIC does is that it provides a lot of support to its members. CalPIC answers licensing and general practice questions. It also has an ethics team that answers ethics questions, and it has a lawyer to answer legal questions. And lastly, as you have seen throughout the presentation, CalPIC is the organization that is advocating on behalf of the LPCC license. And so joining will also support CalPIC's mission to advocate for the license, as it did in first winning license here in California, and its continual work towards full license parity with other master's level licenses. To become a member, go to calpic.org. Follow us to keep up to date on events and things happening within the profession. Now, again, my name is Corinne Eisenhardt. If you're interested in getting in touch with me, my email is corinneeisenhardt@gmail.com, or you can find out more about me on my website, therapywithcorinne.com. Now, again, I created this video and presentation for CalPIC, and they will be available on the CalPIC website. I also give permission to anyone who would like to download this PowerPoint to help educate and advocate for the LPCC license. Please also share this video to anyone you think needs to know more about the LPCC license. Thanks for sticking with me, and I wish you all the best.